I'm Sharon Loftspring, and I serve on the board of the Central Plains and the NF Network. And I'm also the mother of a daughter with NF1. And I want to thank our very dedicated volunteers from NF Central Plains. We're a completely volunteer-run organization, and these programs would not happen without their dedication. So thank you all very, very much. I also want to thank the NF Network staff members who work very, very hard and very closely with us to make our events a success. So thank you very, very much to the NF Network. And one more thank you to our sponsor, Alexion. They have supported this program and many other programs, and they have been a wonderful partner with us. So thank you very, very much to Alexion for educating our community. And last but not least, I want to thank my husband, who's our tech person today and at home too. We'll be moving at a fast pace, so I'm only going to be making very brief introductions of the speakers, but their complete biographies are on the NF Network events page or in your folders. And you'll see also the handouts that they refer to are also posted on the NF Network website under the events page. So when they're referring to a handout, the digital copies are there for you to have and to print if you'd like to. We definitely encourage your questions. So please speak up if you're in person here in Kansas City. And if you're online, go ahead and post your questions in the Zoom question space. We'll do our best to answer as many questions as possible today, or if you have any that we can't reach today, we're happy to answer them offline too. Our speakers have graciously offered to answer those offline. Research shows that education about adult health care can lead to more favorable health outcomes in the long term. So learning about the transition process is really critical. And lucky for you, we have three speakers today who have real world experience in this area and are going to share their expertise with us today. I think it's a very big help to learn how to help our own children go through this process and to help us as parents learn how to let go so that they do manage their own health care eventually. It's now my pleasure to turn it over to Stephen Sheard, who will moderate our panel discussion.
Thank you, Sharon. Good morning to everybody online and here in person. I'd like to start today's session on transition with just a brief introduction with the panelists, my colleagues here. Eunice Lee was diagnosed with NF1 at the age of 7, had significant complications emerging in her late teens. She's an active NF volunteer, serving as co-chair of the CTF Junior Board and on the Southern California Shine a Light Walk Committee. She's committed to strengthening the NF community by reducing isolation and supporting access to care, research, and leadership opportunities. She's currently pursuing a master's in public policy at USC. To my left here is Stephanie Pratt. I almost gave the wrong name. Sorry about that. Stephanie Pratt, who's a licensed master social worker who manages the transition to adult program at Children's Mercy Hospital, Kansas City, where she leads communication and implementation of a consistent transition to adulthood practices across the divisions. She brings professional experience in both pediatric and adult hospital settings, along with personal insight as the mother of an 11-year-old with cerebral palsy and a tracheostomy. I'm Steve Sheard. I've been a behavioral health professional for 46 years. I'm a board-certified patient advocate, an patient navigator at Massachusetts General Hospital in the My NF Guide peer study, and I'm board and staff at Brainy Ridge, where we run an NF summer camp, along with summer camps for other conditions. Currently participating and guiding research at RAINS, CTF Engage, and lobby for NF research funding down on Capitol Hill. I'm one of 9 members of my family who are living successfully while managing NF1. Just as a brief introduction to what we're talking about, in thinking about the transition from pediatric to adult care, it's important to understand it. It's a gradual process that can look different for each person. Children develop at different rates and in different ways, have different strengths and needs, and we need to really individualize the process for each person. Independence can look very different for different people. Some will achieve full independence. Some will need support as they move forward into adulthood. Some will need more support than others when they do need support. What matters and what's really important is to create a foundation that allows each individual to maximize their potential for independence. It requires a foundation of confidence, resilience, communication skills, and wellness, some of which you'll be hearing about later with some of the other panelists who are going to be presenting. The process really starts early in childhood. The process of gaining independence in being able to manage your own care is a lot like learning to read. We can't just hand an 18-year-old a college textbook and expect them to read it unless we taught them the alphabet in kindergarten. And the process of transitioning to adult care is very much the same. It starts in childhood. We know from our experience collectively, as well as from the research, exactly what Sharon just said, which is the health outcomes for youth who are prepared to transition are vastly superior if we teach them the skills they need to know. So we're going to present today based on kind of a series of questions that each panelist will adjust. So one of the first questions, one of the first topics we want to address is, what do we suggest that someone do to take the first steps in gaining independence while transitioning from pediatrics to adulthood? And I'd like to ask Eunice to start with telling us a little bit about her experience and what her knowledge about this.
Yeah, so like Steve was saying, I was diagnosed when I was really young, at about 7, and didn't have any complications growing up. And I also grew up moving country to country every few years, and so didn't really have that consistent end of care as a child. When I was 19, I went in to get some baseline MRIs done, and that led to finding some abnormalities in my brain scan and was diagnosed with Moyamoya disease, which is a really rare symptom of NF1. And so within a couple of months, I was getting full-blown brain surgery. And then 5 years later, I was diagnosed with MPNST. And so went through surgery again to remove that tumor. And so I was really thrown in the deep end to manage my NF care in my early 20s. And I'm 29 now, and I think I have a good grasp on how to manage my NF, but it definitely took a lot of practice. And I think since I didn't have those baby steps like Steve was talking about growing up, it took a lot of patience with myself and a lot of support from family.
Thank you, Eunice. So those baby steps are very, very important in terms of helping in a really structured, thoughtful way to prepare youth to make this transition. And we each have a role to play. The youth themselves has a role to play in terms of what they need to be focused on. As parents, we also have a very important role to play in terms of what we teach our children. And it needs to be done in a sequential, developmentally appropriate way for each individual. And the providers who are involved in your child's care at this point also have a very important role to play in terms of helping prepare the child to be ready to truly be an independent adult. It really helps if everybody is singing from the same sheet of music and that we all are working together on the same goals at the same time. And so there is a model available. It's in your handouts. It looks like this, 3 columns. And this model of transition is drawn very heavily from NF Collective and from a site called Got Transitions, which is a national initiative to guide how we think about managing this care. We could spend all day talking about the entire model, which we don't have time to do today. So I'd like to just real quickly go through the handout and just hit on some real key points. A big part of this is understanding that transition starts early. In this model, which is set up developmentally, you'll see that there's chronological ages attached to the model, but understand that we're talking about developmental ages, not just the chronological age, with the exception of turning 18. because turning 18 is a legal issue and everything changes on your child's 18th birthday. So as parents, one of the things you can do is to embrace that mentality that I'm going to transition my child to care and be ready to let go when it's time for me to let go, and be ready to provide the level of support my child needs. And that thinking starts in early childhood. We're talking, 6 or 7 years old is when you start conceptualizing where you're headed. You want to help your child at this stage build resilience, build wellness, develop communication skills. And that all starts very early on. You want to encourage your child to speak directly to their doctor and let the doctor know how their body feels, as well as letting you know how their body feels. And a lot of our children, some of our kids are very gregarious and open and have no problem talking to people. Others are much more reserved. And we need to help them develop those skills so they can communicate what they need to do. Another really important thing you can do for children with NF, especially children with more visible signs of NS, is helping them develop a script. Help them learn to tell their story of their NF, because they are going to be asked. They'll be asked by friends, they'll be asked by teachers. They need to have a way to explain NF that they're comfortable with, that helps them establish solid relationships as they're growing up. As we move a little deeper into the transition process, kind of between 11 and 13, somewhere in that, this is when we really start thinking about the transition planning process and the things that we need to be doing. This is a really, really good time to initiate using more formal preparedness assessment. In your handouts, there is the track, which is a tool from Got Transitions that you can use to assess where are we. There's a parent assessment and a child assessment on themselves, and they can assess where are we at, what skills do we need to be working on. Interestingly enough, our adolescents and parents don't always assess their skills the same way. And that is a really fertile ground for communication about what they need to be learning. And I believe Stephanie is going to be talking a little later, but there are various versions of how to do this assessment. I know your organization also has one. They're all good and they're all very similar, but it's really, really important to be objective about what skills you need to be teaching. You want to be teaching your child how to advocate for themselves, again, building those leadership and communication skills. And about the age of 12, which is the recommendation from the American Academy of Pediatrics, you want your child to start meeting alone with their provider for part of their appointments, which means, yes, you really step out of the room and let the child speak to that physician alone. There's a couple of reasons for that, one of which is our adolescents aren't always comfortable talking about everything they need to talk about with a parent in the room. And we have to kind of accept that that's a part of the process of development. But also, they need to develop that skill of being able to talk to the provider alone. Okay, around 13 to 16, somewhere in there, you really start the formal transition planning process. A lot of times that'll be about 15 or 16 years old, where you start formally planning the transition. Again, you keep on an annual basis, repeat doing that track, that assessment of where they're at. Continue teaching your adolescent how to advocate for themselves. At some point, you want them to start carrying their own insurance card, learning how to order their medications, having them go into the pharmacy and pick their medication up themselves. All of these things that we do for them, when they turn 18, particularly if they move out of your home, they're going to have to do for themselves. And certainly by the time they're 16 or 17, you really want to start having a formal transition plan in place. This is really, really important. If we're going to be prepared, we have to plan. We have to have that roadmap laid out. And I'm going to kind of stop from presenting from the handout right now. There's a lot of information in the handout. I encourage you to look into it and read it. It's a very good model, very effective model. The second thing that I was going to touch on real quickly, I'm staff at Brainy Ridge, which is a summer camp program for children with NF. We've been up and running for about 20 years. And at our organization, we are now embracing our part, doing what we can do in that 1 week time frame to help support this process of transition. We're also doing groups throughout the year to build those leadership and communication skills out of our camp. And for those of you, if your child has never gone to a summer camp, Brainy Ridge is one of the oldest ones around. There are other excellent camps available throughout the country. I really encourage you to have your child seek that opportunity if they're prepared. It's a great chance for them to build independence, but also to form a network for themselves. It's very common with our children with NF to experience a lot of isolation. And unfortunately, social isolation is quite common in our community. It contributes to depression and social anxiety. And we need to help our kids have their own network, their own foundation of relationships that they can take with them into adult life to support their transition into independence. And so camp is one of the wonderful opportunities for that. So at this point, I'll turn over to Stephanie, and Stephanie can talk to us a little bit about what you're doing there at Children's Mercy.
Yeah, absolutely. Thank you. Like Steve said, I am the Transition to Adulthood Program Manager at Children's Mercy in Kansas City, which is a standalone pediatric hospital. So we don't have an adult hospital attached to us right down the hall, but we do cover and treat a lot of the kids and families in the Kansas City metropolitan area, especially those with NF1. We are a program that is administered across our entire organization. We are working to continue to expand. So nothing that I'm saying is like 100% fully there. So we're working, we see the need to progress to expand across our entire organization. One thing I do want to highlight is Steve wonderfully went through all the different stages. If you did not start this at 12, it's okay. We can start it at 18, 19, 20. We just want to know you to know that there's support and help available wherever you are. So I know that ideally we're starting early and that's what we wanted our organization to, but we know the reality is sometimes people get to this point and they're like, I haven't thought about this. I haven't done anything. And so just knowing that there is support available to kind of help you through that process. So at Children's Mercy, our focus is really looking at the entire hospital population. So we're looking at kids in our most complex primary care clinic with seeing 6, 7, 8, 9, 10 specialties. And we're looking at kids in our primary care clinic when that's their only provider. And so we realize that transition has to happen across that entire spectrum. And so that looks very different. Our kids, and we complete a readiness assessment 1 time per year that they get electronically. And for anyone that is currently with us at Children's Mercy, we are transitioning to a new medical record this week. So I apologize for any confusion or issues with any of that, but we are working to be able to do an annual transition readiness assessment that's electronic. We administer annual transition education. So there was a packet that Sharon had. I don't know if everyone was able to see it, but it does have all of our available transition education. So information on medications, calling the pharmacy, knowing your insurance, questions to ask, how do we create a 3-sentence summary, all of those kind of steps of education that we want to provide that we have available to our patients and families that we can work on you with throughout your time at the hospital. Our teams will also do an annual transition conversation with you in every specialty and primary care that you attend. So if you attend cardiology, GI, neurology, and oncology, then we're going to talk about transition once a year in that clinic to make sure we are providing education and planning and preparation moving up to that. And then when it's time to talk about adult providers, which is our most complicated, challenging topic, then we work with the families to really identify what are our needs, how many clinics are we transitioning, where are we going, and we try to find a good medical home for our complex patients. A lot of times we have a diagnosis that indicates where we have to go. In Kansas City being on the state line, a lot of our families end up with complexity, either going to KU or St. Luke's, just from a realistic provider standpoint. And then we work with the other specialties to identify, okay, if this is going to be your medical home, when is the right time for us to transition all of these different specialties? Some families choose to transition all at once, and some families say, I want to transition step by step. And really, we work with where you are. What fits your family the best? Is your child going off to college? And then we need to transition to make sure we have a medical home in that place. Or are they close enough? Maybe they're going to a college a couple hours away where we want to keep their care here with us for a little bit, transition to college, and then transition to adult care. So there's no fine line. We want to transition between the ages of 18 and 22, but we're not saying everyone has to go here and then go at this time. We really want to work on it on an individual basis. We have care management and social work support available to kind of help us through that process. And then each clinic has a clinic transition lead that really is the point person in that area. So we're continuing to work, continue to expand, but really is something we want to be done across our entire organization. With that, a lot of that is we can't do it the same way. You know, we have kids, and I think with NF, you have that whole spectrum. You have a patient like Eunice who is fully independent, working, going to school, in charge of their medical decision making. Then we have young adults that are going to need some support from their parent or caregiver. They might not be attending a four-year college. Maybe they're going into something through vocational rehab and job placement or training programs. And then we have some young adults that are going to need full care guardianship. And so we know that our program and efforts can't look the same for everybody. And so we have our readiness assessments are administered based off of the young adult's anticipated level of independence, and our interventions are impacted by that. For our young adults that will need full care or guardianship, we're not teaching those parents about medications. We're making sure they have support with school transition planning, residential care planning, waivers, all the support that they're going to need to manage a complex care young adult within the adult setting. For our young adults that will be independent or just need some support, then we're really doing in-depth, do you know your medications? How do you call the pharmacy? Have you practiced that? Are you spending time alone with a provider? And so realizing that it can't look the same for everybody. We like to think of it in a shared decision-making model if you think of it kind of like employment. So you think when your child starts care, you as the parent are this manager. You're managing everything. Your kid is going to the doctor with you and kind of saying, do I have to be here again? What medications are you making me take? I have to have this procedure. And then slowly, ideally, your child is getting promoted. Then they become kind of a team lead. They're taking a little bit more initiative, and maybe that manager is going down to kind of a supervisor role. And it's kind of a shift. So then ultimately, by the time they're 18, our goal is for that your young adult to now be the manager and the parent to be receiving that care, where you're there as a support, but they're the primary contact. They're the ones answering questions. They're the ones communicating with their care team. That's kind of our ideal state. Now we know that some kids are not going to get there. And so maybe some kids are always in that team lead, that supervisor position where they can talk. How are you feeling? Oh, I have a headache, or, my medications are making me feel dizzy or something. But we want them to be as independent as possible. And that's kind of our focus. And then all of that with as well, we really focus in on supported decision-making and guardianship needs, power of attorney. How are we making those decisions for our young adults when they turn 18? Who can make those for them? And then kind of what kind of education we need to do to really support them to be as independent as possible.
It's great. Thank you so much.
Mhm.
I think we could have an entire conversation, an entire day's conversation about the different levels of independence and the legal implications and what the options are. I think more recently you made mention of the supported decision making, which is a kind of a newer thing. It's not brand new, but there's something short of full guardianship that can be a really, really good option for many of our kids with NF who need a higher level of support, but don't need guardianship.
Yeah.
How often do you see that?
We see it a lot. We're actually trying to encourage it more. So shared decision making is really the idea of looking at your young adult's life in a way of school, spiritual, employment, friendships, all those different areas of their life, and looking at it with them to say, these are the areas where I can make decisions on. Like, I can decide who my friends are. I can decide what I want to eat today. I can decide these things, but I might need help with these bigger decisions. And so they can go through this form and planning to kind of say, yes, I need help on this. I can do this. I need someone else to do this for me. And it just allows to identify all those different areas that a young adult can be independent with. And you can, it does not, it's not, the one caveat with supported decision making is it's not a legal document in every state yet. Most of the states have legislation coming to the floor to be able to get that approved so that it can be used as a decision-making document for medical care. But most providers will really accept it to be able to say, like, how involved, where is your young adult tapping into this care? Not all of our kids need guardianship, but not all of our kids are fully independent. And so really being able to support that independence level. And if you have questions on that, I highly encourage you to talk to your care team, talk to your social worker in your clinical area, because they are experts in this area to be able to help you determine which level of decision-making support is right for you. We also really encourage, when our young adults have guardianship, to still do supported decision making, because even though they can't make those big decisions, there's still things in their life that they can participate in. And maybe it's choosing what you want to eat. Maybe it's choosing the clothes you want to wear or what you want to watch on TV, but making sure they're making those decisions when they can.
That's good. I really supporting the maximum potential for independence is so very important for our kids. We'll talk a little bit about this later. One of the challenges we as parents have is also letting go and knowing that there's going to be times when maybe our kids will kind of fall on their face, just like we did growing up. Eunice, you also are active at CTF in some of these issues. What's happening at CTF?
There's definitely resources available with CTF. CTF is part of the NF Collective, and so I know as part of that group, they've done a series of webinars focused on that transition from pediatrics to adulthood. And so I would definitely take a look at those if you're interested. And I would I would suggest reaching out to any of the other NF organizations that you're interested in to see if they have other resources available. As Steve mentioned, I'm on the junior board of CTF, and so we have a patient outreach committee. And so I would say the committee would be more than happy to talk to anyone who wants to maybe get some input or just talk to a young adult who has gone through NF.
All right, great. Thank you, Eunice. Um, we just made reference to a shared decision-making model, which plays out in a variety of different ways. Most organizations these days actually have a formal shared decision-making initiative in place, particularly the larger hospitals, and it has a really specific meaning. In a shared decision-making model, sometimes you'll hear it called patient-centered care. The patient is at the center, and the patient is the decision maker ultimately. Shared decision-making is about a provider, a doctor, a nurse, and the patient having an equal voice in all decisions, and the patient being very actively involved in making any treatment decision whatsoever. Uh, Stephanie, from a provider perspective, how do you think that works?
I think from our care teams, we feel that the more engaged a young adult can be in their care, the better the outcomes. Because a provider can tell you to do all these things. Your parent can tell you to do all these things. But if a young adult just sits there quietly and isn't participating in the conversation, isn't asking questions, then what's going to happen when they're not living in mom's house anymore? What's going to happen when they're out on their own or in school or out with a friend and they have an emergency come up? So we really take an onus to really make sure we're engaging with the young adult, asking them questions first. So we want the young adult to be answering, and then mom can hop in and dad can hop in and caregiver can kind of give their perspective. But really trying to get our teams to look at that young adult is that person that needs to be participating, because then we're just talking to them. If they are not absorbing what we're asking. So we're really trying to incorporate health literacy with this and teach back to make sure we just told you a bunch of stuff. Can you teach it back to me? I just went over your medications and why you're taking them, or this procedure you have to have. Why are we going to do that? And really to make sure the young adult is engaging, retaining, and being able to keep moving forward, it really helps us to provide effective care.
Thank you, Stephanie. I think that one of the things that is really important, and we see this kind of across the gamut not with the young adults, but with older adults too, is that some of the treatment options we have are not a picnic to be taking. And, it's fabulous that we have the MEK inhibitors now, like Go, and it's such a huge, benefit to the NF community for many people, but it's also not necessarily easy. There can be a lot of side effects with these treatments. And if our young adult is not committed to and understanding the choice they're making to engage in treatment, they're not going to do it. And I can tell you, I've worked in behavioral health for a long time. Managing those side effects is something you have to do in advance. They have to understand what those risks look like and also understand why they're taking it. Why are you willing to put up with this? What is the benefit to you? And if the patient is not actively involved in making that choice, the chances that they'll stick with the treatment are pretty slim.
And I would say, as a caregiver, making sure that if you're not getting that from your provider, if they're not taking the time to really engage with your young adult, to your child, to say, do you understand what these negative impacts could be? You understand what these side effects, understand the benefits. What could this give you? What kind of independence can you give you? Then ask the questions. Because some providers kind of get in a rut. They've got a lot of patients today. It's a busy clinic. We're going to go over this. We're going to go quick. It's okay to ask them to stop, re-explain, and make sure that your young adult understands what we're talking about.
That's great. Thank you. Eunice, you've more recently made this transition and now have to participate in shared decision making with your provider. What's your perspective on this?
I definitely try to take a collaborative approach with my end of care team. I think every appointment I have, I will think back to my last appointment and think about what symptoms I've experienced, what concerns I've had, what questions I have, and then look ahead, maybe the next 3 to 6 months, and see what imaging do I have, what procedures do I have, what other specialists am I seeing, and how can I make sure that we're all on the same page? And I think the core of what really inspired me or pushed me to really take this approach is understanding the reality of NF and the role that it plays in my life, not only now, but the long term. And I think, really fully grasping what could happen and what I need to look out for has really pushed me to really advocate for myself and make sure that I'm getting the care that I need. And I think by taking this approach and working collaboratively with my doctors, it's just been a positive feedback loop where they're working with me and they're giving me the care I need. And they're also further empowering me to continue advocating for myself. And, I think it's important to do that with your NF care team, but also with all the other doctors you see. I think with NF, we see so many specialists, and our primary care team is also so involved. And so just making sure that you know how to advocate for yourself in a way that works for you is really important. And I think, like Stephanie mentioned, work with your care team. How can you take that collaborative approach and how can you make a positive impact on your own NF? I think that's something really important to keep in mind.
Thank you, Eunice. And what Eunice said really involves a lot of different skills. And I can tell you in seeing older people with NF or other chronic conditions, this is a huge challenge to everybody, no matter what your age. And if you don't have the base knowledge and skills to do this, you're not going to succeed. And we need to prepare our young people to do this. So when we're talking about these different skills, some of the things we need to be thinking about is teaching the basic communication skills, understanding the condition, and NF is a very complex condition that can evolve and change over time. And literally throughout the lifespan, it can change. Teaching to be organized and prepared for appointments, something that Eunice was just talking about, is a huge challenge. I see this all the time with adults of all ages, particularly with a complex condition like nerve fibromatosis, where there's so many different bodily systems involved. Being organized when you go to your appointments is absolutely vital because otherwise you won't get the care you need. And with NF, because we know, in fact, that we do have people with NF with neurocognitive challenges, attention deficit disorder, different learning disabilities. Taking a very structured approach to organization is absolutely essential. And many of our folks with with NF, adults and children, really struggle with staying organized. Learning to manage the medications. Here's a big one: learning to navigate insurance. I can't tell you how many times this comes up in the patient advocacy world. All of the people, you can't see all the people in the room shaking their heads. Yeah. Navigating insurance is a huge challenge. It's an incredibly Byzantine, complex, not patient-centered process to access the care you need. And we could, again, spend an entire day going through training about how to navigate insurance. There's a lot involved in that. And something else that's really important in this process, Stephanie, I'd ask you to a little bit talk about, was the transfer of medical records.
It's very tricky. So I think the first thing you have to think about when you're transferring medical records is the adult provider does not want 18 years of medical records. Honestly, they're not going to read it. It's wonderful. It's wonderful to know all this, but if they get this much, they're going to look at something this much. So there's a couple of different things that we've done with a lot of the big hospital systems. A lot of them are moving to something called an Epic system. So a lot of them are on Epic, where we can interchange records. So for some, if they're on the same system, they can access. So like if for us in Kansas City, both KU and St. Luke's can now access the records at Children's Mercy. So that makes it really easy for them to see what has happened. So there's an interconnectivity that's going on with a lot of big hospital systems, which is really great. The other things that we've started to do is creating medical summaries, where at the time of transition, we're going to summarize what's happened. Your specialists are going to say, we've had this procedure, this is our diagnosis, these are our medications, and then do a warm handoff with that provider so that we can kind of say, here's what's going on, here's where we're handing you this patient in this way, so that it prepares the adult provider in a way where they can actually be prepared. Because if we send all these records, they're not going to read it and they're not going to know anything when you walk through the door. So we're trying to give it in a way that they can easily absorb it and obtain it.
Very good. So one of the handouts you have available to you in electronically, we didn't print one of these, but in your announcement, you should have seen a link to a formal written transition plan and what that can look like, which is, again, it's just a summary document that takes all of that 18 years worth of information that you have and shrinks it down into a single document that is manageable for the receiving provider. And I can guarantee you our providers love them to death, and they are up to their eyeballs in paperwork. And so we need to be very efficient in how we think about transferring this information so that they can stay focused on what really matters right now. All right, really good. So one of the things that we've made reference to a couple of times is staying organized and being prepared for your appointments. Eunice did a really nice job of describing what she does. So another one of your handouts in which there's also a link to a training video is about how to write an appointment agenda. And as a patient advocate, this is something I teach all of the patients I work with to do. And it's really, really helpful to go in with a written agenda, a list of your questions, a list of your goals of what you want out of treatment, and then also a prompt to yourself, but also to your provider when you start talking about treatment options, to talk about all of the options. I can't tell you how many times I've gone to an appointment where the provider would recommend one treatment only, when really there was a choice of 5 different ones. And again, shared decision making, what that means is you know all of the options, and you will review all of those options as well as the benefits and risks of each option before you make a decision. If your provider is going to make a recommendation to you for treatment, why? Why is that the best choice? It's not fully informed consent, and it's not shared decision making unless you know all of the options. And so going in with a written appointment agenda helps you stay structured. It gives you a place to take notes, and it will help focus the appointment on the things you really need to be aware of. I can also tell you, I typically have a lot of things to talk about when I go see a provider. And if I don't have a list, I won't remember them ever. That would never happen for myself. I wouldn't expect it to happen for most anyone. A couple of other things you can do to be prepared for appointments is exactly what Eunice already said. Make sure that you bring your current medications list. I can tell you, my systems, my providers use Epic, and the medications list they have for me in Epic has never been right once, ever. My NF specialist, Dr. Blakey, and I, we laugh every single year. We laugh because she and I sit there and we correct the medications list, and then the next time I go anywhere, it's still wrong. So always bring a copy of your current medications and dosing. Um, it's really helpful to bring updated labs and reports, just like what Eunice was just saying. You can't assume that those reports got forwarded. And it's really helpful if you bring hard copies with you to your appointment. And it also can be really helpful to bring a list of your current and past providers, particularly if you're seeing a new provider, because they're going to ask you who are your providers. And I can tell you for a lot of us with more complex conditions, that list is pretty long. So it really helps to have that list with you. Another thing to talk about, I think that's really important, is bring someone with you when you're going to do a really complex appointment. If possible, having that second set of eyes and ears with you can be very, very helpful. And it's something I've done, like when I've made really major decisions. A lot of times I'll bring somebody with me because they can be a sounding board and help me remember the things that I've forgotten. And so that can be very, very useful. Stephanie, you had a few things you kind of started to address this, but could you talk about the 3-question summaries?
Yeah. So one thing we do at Children's Mercy is we do something called a 3-sentence summary. There was a research project done, and it basically said patients and young adults have about 13 seconds at the beginning of an appointment before the provider will jump in, and say, these are what we're doing, this, we're talking about this, and this. But really what we want you to do is be able to take that time and ask your questions. And so what we encourage our young adults as we're starting to learn how do we learn our medical care is can you summarize in a 3-sentence summary? So my name is Stephanie, I'm 17 years old, and I have NF1. The medications I take currently are, here's my current treatment plan. And then the question I have for you today is, this medication is giving me some really bad side effects or something. So to be able to help our kids summarize what's happened between your last appointment and then practice being able to give those summaries of your condition really helps them to really start to take ownership of their care and what's been going on. And obviously, you as a caregiver can step in and give additional information, but we can really encourage them to start practicing that. We found it to be really, really helpful. The other thing is I fully agree with everything Steve said. Bring in all those things and print and all that. I also know working with teenagers, no one wants anything paper anymore. I know as a parent, when I get discharge instructions, I'm like, where am I going to put this? It ends up in my car and something. So we're really encouraging use of the patient portals because it's all right there. So you can see your labs. You can see your medications. And so getting your kids access to their patient portal is vital if they are able to engage with the system. So I know our new one at Children's Mercy is kids can start getting proxy at 13 to 14, like limited child access to their patient portal. That means they can send a message to their provider if they have a question. They can look at that list of medication. They can look at those labs that were just done, and we can start to teach them how to do that. So I strongly, strongly encourage use of the patient portal for you as a caregiver to connect and communicate across your care team, but then also getting your kids access so that they can start practicing.
Yeah, I would, it's a great way when you have multiple healthcare electronic medical records. It's a great way to transfer labs and reports because typically you can upload results from outside of that organization. And actually, it's a big benefit to your provider because if you do take them that paper copy, they can't do anything with it. They don't have a paper file for you anymore. And so you're actually saving them a lot of time and trouble in terms of scanning that into the chart. What's your experience with patient portals been like?
I would say they've been super helpful. You know, it helps me stay organized because everything is in one place. I can see my past visits. I can see my doctor's notes. I can see my future appointments. What do I need to start thinking about? What do I need to start planning for? And it really helps me develop that agenda that Steve was talking about. I remember, I think one of my very first appointments I went to by myself after my brain surgery. I didn't know what to ask my doctor. I didn't know how to, understand the information my doctor was giving me. I wasn't able to synthesize the information either. And so I think what Stephanie is saying, that 3 sentence summary is so important. I remember leaving that appointment more confused and more questions after. And I think, those learning opportunities, I think, really helped me grow and really helped me prepare to be where I am now and really think holistically what my NF and what my health looks like. And so I would say definitely take advantage of the patient portals and work with your doctors to make sure you understand the information and the way that they are communicating it to you.
I think too, as our kids are going to adult care, like Eunice just said, it was really confusing. I think making sure they understand the difference between a pediatric appointment and adult appointment is really important because that's something that we're working to teach them because everyone knows you go to the pediatric hospital and it's very like slow. The appointment types are slower. It's a family centered, and we're going to make sure you understand what we're telling you. Adult care is different, and that's just the reality of adult care. And so making sure young adults know when they go to that first appointment by themselves, it's okay to say, I don't understand a single thing you just told me. Can you revisit it? Can you explain it in a way I can connect with it? And so making sure they feel comfortable asking that and saying that, I think is super important.
And they won't be able to do that unless we taught them how. And that's
Absolutely.
what's so important, is teaching that, not just the communication skills, but also having the self-confidence to question that doctor in a white coat who is kind of scary, particularly when you're a young adult, to challenge saying, wait a minute, I don't understand what you're saying. And we got to equip them with the skills and the ability to do that. So the last part of this, just to kind of wrap things up, and I'm sorry, I'd like to spend like 4 hours talking about this. We don't have quite that long. Few things to wrap up. One of the things that I'd speak to as a parent is the importance of our being able to let go and to let our young adult be an adult at whatever level they're ready for. But certainly we're hoping for full independence for most of our kids. It can be hard. I have my kids are 42 and 39. And there's times I still struggle with it. So letting go, knowing that your kid is ready, that's what makes it possible. Knowing that we prepared our young adult to be a young adult is what makes it possible for us to let go. And we need to let them go because they need to develop the independence to go live a good life as an adult. And it all hinges on how we prepared them. Eunice, what are your thoughts? What do you wish you'd known?
I think something I wish I had known is that it takes time. It sounds simple, but it's not. Like, it takes time to understand how you want your NF care to look like. And I think it's important to know that everyone is on their own timeline. Everyone will be ready at a different age. Everyone will be ready to take a certain level of, ownership in their NF care when they're ready. And it's a partnership approach with your caregivers, with your family. And I think it's really important to know that it can be scary and that's okay. And having support from family and loved ones is really helpful. It means everything really. And I think your doctors will understand that sometimes you might not be ready and sometimes you need that support. And sometimes that little nudge is really helpful because, I think eventually everyone has to take ownership in some way. And so just taking that holistic framework and support is really, really important.
Thank you, Eunice. Stephanie, what closing thoughts would you
I
have?
think the biggest thing we tell families is it will be okay. Adult care will be okay. It'll be different and it'll function differently than pediatrics. But most of the time, when we talk to families after they've gotten there, after they've engaged, they're like, it is okay. It's different. It's not the pediatric hospital, but as long as they can go in it with an open mind, understand the differences, understand that you're not going to have that wonderful multidisciplinary clinic that you go to now. That doesn't exist in the adult world. We would love for it to, but kind of knowing that and understanding that it'll be okay. We'll go to a couple more. We might have a few more appointments, but it's going to be all right. And a lot of our teenagers tell us, I'm ready to leave the pediatric hospital. I want someone to talk to me like I'm an adult. I'm 20 years old. I don't need the piano playing as I enter the hospital, And so I think realizing that we can't hold on just because we're scared, that these are wonderful providers that we can engage and connect with. It might just be in a different way.
Great, thank you so much. All right, well, so we've reached the end of our panel presentation. How are we doing on time?
Great.
Doing good? Yes, question.
Question. So I know now that some of the doctors have software they use to transcribe the appointment, take notes. Is there something like that a patient could use to get a summary of the appointment so they're not having to like furiously take notes the entire time? Pay attention.
Okay, so the question that was just asked, if you couldn't hear it, is about the AI software that physicians now use to transcribe the notes during your session. Nearly every doctor I see has that. And yes, the answer to the question is yes, there are softwares that you can use. Usually they're loaded on your phone to record an appointment and summarize it. The issue is you need the consent of the provider to do it. And there are actually many medical institutions will not permit outside recording of their sessions. So it's something you'd want to check on in advance to see if that's okay with your doctor. One of the things I've noticed, and it kind of speaks, though, I think, answering your question in a slightly different way, is the quality of my provider's notes has radically improved since they started using that software. And in the patient portal, I can access those notes. And I can tell you in the last year or so, since I've seen my providers using that, what's in those summary notes is way better. And so accessing those notes through your portal is now, it means more than it used to. At least that's been my experience. What do you think?
I think I agree with that. Accessing the note portion. So if we're talking about medications, treatment options, all those things you reviewed with the provider, let that be in the note. And we usually tell people if you're taking notes jot down your questions or your emotions. Like I got really scared when you talked about that treatment option. So thinking about what you're retaining, because the clinical piece will be available to you. So what they're telling you, but kind of jot down what are you feeling with what they're telling you, because then that can help us ask questions. But because you're never going to be able to transcribe everything the provider's telling you, because you're going to be more focused on writing it than actually retaining it. And so knowing that you're going to have access within probably 24 hours to that clinical note, write down the questions and emotions you're feeling as they're sharing that with you, because then you can connect on it. Then you can send a message in the portal to say, hey, I saw your note. We talked about that. I still have more questions. I want to ask these things. So that's just a way to kind of retain that. Because I know we at Children, like you can't record, they won't let you record the session with the provider. Some do without asking, but really, I think that's kind of the way that we usually recommend, so you don't get overawed in the specifics of it.
Very good. Do we have other questions?
I have a question. If you are, we have a 20-year-old with NF and she is doing a lot of appointments on her own. And she seems to run into she does lack some of that confidence you're talking about. And doesn't know the right questions always to ask and cannot really take notes. So that's kind of an issue for her. She can't really do that. But a lot of times she will run into providers that will not listen to her, or they sort of put her off, like her opinion doesn't matter much. And, if she has a concern or doesn't like something, they very easily brush her aside. It's very similar to what some teachers will do.
Right.
A lot of doctors are great, a lot of teachers are great. And then there's others that are just like, oh, I don't have time for you, basically. And so how do you suggest handling those types of doctors? I mean, ultimately, if it were us, we would find someone else, right? But she doesn't always have those skills to know, am I supposed to listen to this person or should I just go find somebody else?
Eunice, do you want to try that one?
Yeah, I mean, I think if it's possible, a second opinion is always helpful.
Okay,
If that's not always feasible, I think finding ways to communicate with the doctor in ways that work for her could might help. Maybe if she could email them or call them or use like the My Chart system to send them a message and follow up and just really be persistent. And I think showing that persistence and showing that you understand what your NF looks like and what you need to your doctor, kind of you'll gradually build that relationship with your doctor and eventually they'll start listening and start working with you collaboratively. I think just finding ways that maybe you could support her to just slowly build that confidence and think about what questions she could ask and what she's curious about and what she wants to know more about her NF and finding ways that she's comfortable to communicate with her doctor is might be a good approach.
okay, yeah, thank you.
Also-
Oh, sorry.
Go ahead. All right, I'll go ahead.
Okay.
So another tool, the whole thing, the reason I mentioned the going with a written agenda is in part directly to deal with that issue. Is that if, particularly if you know in advance what kinds of questions you have, put them in writing, hand them to the provider. When I do a written agenda, when I take it to appointments, I have my copy and I give the doctor a copy so that they know what I'm looking for. And one of my rules of thumb is if I go to a doctor who takes my list and puts it aside and ignores the things I want to ask, that doctor's immediately fired. But you did say that correct. It does require a certain amount of self-confidence
Yeah,
to say, you know what, you're not a good match for me because you're not engaging in shared decision making.
Sure.
And you have to, and that's something where, you may be able to provide, as a parent, provide support to your young adult to say, you know what, that provider doesn't sound very good. Let's find you somebody else.
I think the one thing that I would say, and I agree 100% with what they said, but I think there's onus on the healthcare system there. I think that if you are not getting what you need from your provider, there are places within the system that we can plug into. So you said like sometimes note taking is hard. There are adaptive technologies that we can look at getting her, something to say, is this an opportunity to record a session? Or do we need to extend that appointment time to give her a little bit more time to think about the questions that she has? Letting the provider know that, hey, we're going to need to add some extra time in here for questions, talking to the social worker, talking to a patient advocate to say, like, I'm not getting what I need from your care team. Sometimes we are pigeonholed a little bit by providers and that what's available in our area. There's only certain adult providers that treat this. And so if we need to, for a certain diagnosis, it's the same with transplant, certain oncology diagnoses. So we see this a lot of, this might not be, we might have to work with this provider to get to a point of appropriate levels of care. And so I think the hospital that you're going to, the system, can support your daughter to engage with those providers if that's a provider that you want to, obviously if you're like, it's not a good fit, we're going to see someone else, there's a bunch of other options, then I think that that's great. But also there are people within the system to help improve the relationship that they can create together.
yeah, that's helpful.
Great. Yes.
Can you all address consents once they turn 18 as far as just a reminder what roles parents can play as far as going to the visits, sharing information with parents, getting their prescriptions for our kids?
I'll tell you a story in answer to your question. So I was working with a group of parents from the camp, and one of the parents volunteered this is a child with type 1 diabetes, on their child's one day after their child's 18th birthday, they called the pharmacy to get the medication, the insulin renewed for their child, who's now a young adult. And the pharmacy said, we can't talk to you because you didn't get a release signed. And so regardless of, unless you already have a guardianship agreement in place, on their 18th birthday, everything changes, and those providers can no longer say boo to you without permission. And so it's a really important part of the planning process. If your child wants you to stay involved, which most of them do, I mean, usually they still want help, after their 18th birthday, you have to be prepared for it. You've got to get those releases signed in advance.
Yeah,
Just-
I would say, but a lot of times they can't sign it until they turn 18. So as much preparation as you can do, there's some things that just can't be done until their birthday. And so being prepared for that. We usually tell families don't schedule an appointment 2 days after the 18th birthday. Like, let's not schedule a procedure that next week, especially if we're needing like guardianship, because in Kansas and Missouri, we can't go file the guardianship paperwork until that birthday. You can have it ready to go, but there's still like a court date and all of those things that have to happen. So just knowing that they're going to have to grant you proxy access, knowing that you're going to have to file that, just kind of let's fill our meds the week before, and so just it's a little bit of planning on our end too. And we usually tell people it's like a light switch. Everything changes.
Yes.
Another question, and I guess because you're closer to this than any of us are, that transition period and whatnot, obviously. I do remember a little bit back in the day, lucky as it may be, that my knowledge of healthcare, of issues of medical, of anything was pretty narrow when I was in college, right? So 19, 20, 21, 2, 3, what? Now, if I need a lipid panel or I need an issue with my cholesterol, I'm gonna go research the hell out of it, make sure I understand it. What's your thought on that? I mean, kids aren't gonna, and I say kids literally up until, mid-20s aren't really there. What's your take on that? Being able to deal with it yourself.
Like the research part.
Just the whole, yeah, knowing what you're actually being told, understanding it, researching. But
The question is, if you couldn't hear it online, the question is about in this day and age, how different it is access to information. And, when many of us older folks were growing up, you would have gone to the library and looked it up in an encyclopedia. Now that information literally is at your fingertips. So what are the implications for that?
I think it can be good and bad at the same time. I think it's good in the sense that if you don't understand something your doctor is telling you, or if you don't understand your diagnosis, as soon as you get it, you can Google it and you can get information from reliable sources. But at the same time, too much information can be overwhelming and scary. And so, in that sense, I think, there's a balance. I've definitely been there where I'm trying to research something like for example, after I had my MPNST removed, I was Googling like what's the probability of another MPNST growing? And so I think in that sense it can be scary. And so I think, you know, use it to your best judgment, I would say. Get the information that you need, and whatever else that may be too much or might scare you, I think just keep that in mind. Maybe talk about it with your doctors and tell them, oh, I just had my MPNST removed. I'm concerned about the probability of another one growing. What can I do to make sure we're staying on top of this? And develop a plan with them. So I would say use research to help you plan and help you communicate with your doctors and help you understand what's going on.
did you have your parents as part of that process to help you?
I did, yes. My parents have always been super involved. They live in the Philippines and I live in LA. And so I think every time before my appointment and after my appointment, I FaceTime with them, I debrief, I prep with them, I make sure they know what's going on. And, I think every big decision I've made with my NF, I've talked about it with my parents, and they really encourage me to make my own decisions, but of course, I value their input so much.
Yep. And I think it's real important. This is true for all of us as adults as well, is if you go Googling around about NF, you're going to run into a lot of very scary looking garbage. And it is not nuanced information. And you can only use the internet if you already have a base of knowledge. And that's where, again, teaching our kids as they grow up about NF so that they have a foundation to maybe interpret some of what they're seeing, then that's the best way to equip them. Because if you just chat GPT or Google something, you may get some good information or you may get not such good information.
We'll tell families to look at your kid's face while you're getting information. So if they start talking about a procedure or lab or something and they kind of gloss over, that's where you as a caregiver can stop the provider and ask them to re-explain it to them. So just kind of pay attention and zone into what they're learning and how they're learning it, I think can be really helpful.
One, really important to engage with advocacy, like you have Central Plains when you're seeking this information, because to your point, it's nuanced information. You know, CTF, NF Midwest, NF Network, they've got information all over their website about NF that is probably appropriate for patients to read, as opposed to ChatGPT or Google. Those two sources are generally not as productive as what our advocacy groups put out. And then going back to the conversation about transitional care and having that 18th birthday, it's important to remember that's all healthcare providers, dentists, orthodontists, chiropractors, whatever that is. My son just turned 18 and our dentist won't let him schedule dentist appointments for him. So he has to do that on his own because we didn't sign the release at the dentist's office. So I just want to make a comment on that it's not just your medical doctor, it's all of your healthcare providers that you're engaging.
A little bit on insurance issues, and I know that's a huge problem. Can all of you address some tips on navigating? I know that could be a whole session in and of itself, but on navigating insurance or what resources are available for parents and young adults.
And the resources that we have for Children's Mercy, we kind of start with just how do you read an insurance card? Because your mom's had it forever. She's had it on her phone. And maybe we've downloaded it onto our teen's phone, which is something we really encourage, that if you have a PDF and your young adult has a phone, like a smartphone or something, download that in their document section so that they can start to hand it to the registration person when they check in. And so the first is just, what is all the information on it? What does it mean? What is health insurance? So kind of understanding those things, and then start talking about what kind of insurance you have. Do you have commercial insurance under your parent? Is that going to continue after you turn 18? Do you have Medicaid? And maybe that's ending because every state's Medicaid program is different. Do we need to apply for new insurance when you turn 18? So those are all things that we want to kind of think about and talk about. But know at the hospital, talk to your social worker. If you have questions about like, hey, I don't know this ins and outs of my insurance. Most of the insurance companies have a case manager that you can reach out to them to ask questions and understand. But that's really an important thing to kind of make sure they understand what insurance they have, what coverage do they have, and when does it end? Those are the big things we encourage to kind of know.
Absolutely. What I would add to that, a really important thing, particularly for those of us in a space like NF, is to understand that no does not mean no when you hear it from the insurance company. And it's very common for really expensive medications to be disapproved initially. And sometimes your provider can get it approved for you, and sometimes they can't. And it's important to know that even if your provider can't get it approved, that's not the end of the story. And you as a patient have a fundamental right to file your own appeal to any denial. But that is a very labyrinthine and Byzantine process, but you can succeed. In my own life, I have a medication I needed that cost $220,000 a year. And my insurance company said, not only are you not going to pay for it, we're never going to pay for it. And I told them, no, that's the wrong answer, and filed my own appeal and won. And it's important for patients to know that you can do that. And in fact, there is support from organizations like Alexion. If you run into that problem, there are resources available to you to reach out and get some help. Because trust me, that's a part of why patient advocates exist, is because it's so difficult to manage these systems.
And with that, I think as a parent, as a caregiver, I think obviously you're going to be the ones advocating for that when your young adult is young. But when you have a 20-year-old, when you have a teenager, those are things where obviously you're going to be the one on the phone probably while they're still in your house and kind of supporting them. But explain to them what you're doing. Like, hey, your insurance said they didn't want to cover this. So to get this for you, we're going to take these steps to kind of give them an example and a roadmap so that when they're out of your house, when they're living on their own and they have this encounter with their own doctor, that they can remember what you did, call you for questions, but then they can be the ones to make the call in the future. So use what you're doing as an example for them and how you advocate for them.
Yep.
We just have one quick, is it a quick question?
Question is, what are some suggestions when navigating this and having providers that essentially rebuff the child? My daughter is 12 and does an amazing job at advocating, speaking up for herself. We've run into providers that disregarded that because of her age.
Wow. You want to try that one?
Yeah, I can.
We'll end on that. Cassie.
So I would say you as a parent can engage your patient, your child in that conversation. We do have some providers that are very like, think 12, just even though we say to start at 12, some providers are like, that's too early. I'm very hesitant as a provider to have the child being the person fully. But I think you as a caregiver can bring your child into the conversation, because when your child's 12, you're still the ones making all of those like medical decisions. But if the provider asks like, hey, this is what we're going to do. And as a parent, you can look back and say, do you understand this? You know, I have an 11-year-old and she answers questions at her pediatrician's appointment. You know, she says what she needs, you know, questions, and they ask me and I kind of look at her and allow her to make that answer. And then obviously I'm giving additional information in there too. And then if you get pushback from that provider, I think that's where you go to the social worker. I think that's where you go to the patient advocate. You go to the clinic staff to say, look, this provider isn't meeting my needs as a patient. If you like the provider, say, look, I'm okay staying with them, but we need to get to a point where they're going to meet our family's needs. Utilize the people at the hospital that are working there because they work for you. They are there to serve you, serve your child, take care of your family, and let them do that in a way that meets your needs, not that just meets theirs.
Yeah, I would agree 100%. As a parent in that situation, if the doctor was refusing to engage my child, I would just turn to my child and say, what do you think? And redirect the question that the provider's asking me to my child if I know they're capable of answering.
Honestly, I would say way to go at 12, engaging your child in those conversations. A lot of times we're seeing the spectrum of trying to get parents to engage their kids in conversations, even when those kids are much older. So you're doing a great job advocating for your child to participate. So just keep doing what you're doing and utilize the people that are there to support you.
Thank you to all you Zoomers who are online today for participating. We hope that you have some valuable information that you can take back with you and some practical tips. Again, please check the NF Network website. All the handouts and the resources are there. Want to thank Alexion again for making this possible and our wonderful panelists who were here. And for those of you who are signing off now, have a great rest of your weekend, and our Kansas City group will be continued soon. Thank you.